guys. Glad to see you guys. As you know, so my name is Dr. Jay Yoo. I'm the chiropractic doctor in US and physical therapist in Korea. I'm also director of the WINBACK Asia Academy and the chief master trainer. Today we're going to have the first our WINBACK Asia Academy webinar in 2024. So we will present webinar in every month by every different subject and the different WINBACK Asia Academy trainers. Next one is WINBACK Asia Academy webinar will be 14th of the June by the Shinji from the Japan. So my subject today is rotator cuff injury treatment by the WINBACK. I'm working in the osteopathic clinic, so there's many patient of the shoulder problem. I treat about the 90% of shoulder patient by WINBACK. I use WINBACK as a pain management and rehab, rehabilitation, and manipulation and control the inflammation. Most of my patients experience about the 70 to 80% improvement within the 3 to 5 session. So let's get it started. So in rotator cuff, we will start with the anatomy first. In the rotator cuff, we should look at the humerus at first. In humerus, the convex articulation is directly like posteriorly and medially and superiorly. So you should memorize, you should know this position. And the 45 angle is formed between the articular surface and the shaft of the humerus. The shoulder complex is complex function through the interaction at the four joint, sternoclavicular and scapulothoracic, and the acromioclavicular and the GH, glenohumerus joint. When you move the shoulder, these four joints should do their function properly, especially sternoclavicular joint is very, very important because the movement of the arm start in sternoclavicular joint. So if there's some subluxation or malfunction in the sternoclavicular joint, the right motion of the arm cannot be happen. Therefore, we should check the sternoclavicular joint when your patient has some problem of the shoulder. GH joint. So GH in the glenohumerus joint is allowed to abandon motion at all three plane, but does not promote a high degree of the stability. The ligament and capsule of the GH joint are relatively very thin and provide only like secondary stability to the joint. The premier stability force of this joint is garnered from the like surrounding muscular, particularly rotator cuff muscle. So rotator cuff is a group of the four muscle, including the supraspinatus and the infraspinatus and the subscapularis and teres minor. These four muscle is composition of the rotator cuff. So GH joint. GH joint, as you know, is ball and socket. So they can usually other joint is like sliding or like something like that, but ball and socket joint only like with the shoulder and the hip. So in ball and socket joint is advantage of the motion, but disadvantage of the stability. So it GH joint is ball and socket joint. The primary motion of R is the abduction, adduction, and flexion and extension, and internal external rotation. So there's six motion in the GH joint. So the GH joint is allowed approximately 120 degrees of the abduction. The full 180 degree of the shoulder abduction is normally occurred by combining 60 degrees of the scapular upright rotation. So if you move your arm like 180 degrees, 120 is case from the your GH joint and 60 from the your scapular. So scapula is very, very, very important for the like GH joint muscle motion. The articular arthrokinetics of the abduction is involved is convex of head of humerus rolling superiorly and while stimulously like sliding inferiorly. So rolling superiorly and sliding inferiorly. Without this inferior slide, the upward roll of the humerus will be resulting in the like humerus head is jam in the acromion. So we call this impingement syndrome. Often result is damage of the supraspinatus muscle or like subacromial bursa. So even though we don't have muscle, they should and wrist, they should have some stability. So with the optimal posture of the scapular is little GH joint muscle activity is required for the stability for the rest. So ideal posture of the scapular is glenar fossa is tilted about 5 degrees, not this, like that way, 5 degrees. This position is not only approve the contact of the articulation, but allow this surround soft tissue to help this joint, supporting this joint. So, the glenar fossa and humerus head, like this way, not that way. So relatively large amount of GH joint instabilities produced by relatively small alternation in the posture of the scapular is good evidence. The proper posture of the scapular contribute significantly to stability of the GH joint. So so the right position of the scapular is critical to the stability at the rest and decreasing overall rotator cuff and the ligaments. If joint cannot relax at rest, stressful condition is possible to be happen during their motion of the shoulder. Therefore, if you have patient have some shoulder problem, we should check the condition at the rest first. Okay, as I mentioned, the rotator cuff is composed of the supraspinatus, infraspinatus, so supra, infra, and teres minor, and subscapularis. The supraspinatus is spread out in the horizontal band to insert the superior facet of the greater tubercle. So like this way here of the humerus. And the subscapularis origin is divided from the remainder of the rotator cuff origin as is deep to the scapular. The inferior spinatus and the teres minors fuse near their muscular tendinosis junction, while the supraspinatus and the subscapular tendon join us the shed that surround the bicep tendon at the entrance of the bicep group. So rotator cuff injury. The tendon at the rotator cuff it can be torn. So rotator cuff tear cause like severe pain and weakness arm or cracking or sensation of their cracking sensation on the movement of the shoulder in a certain position. So there's many there also there may be stiffness and swallowing, a loss of movement, a loss of function, or tenderness in front of the shoulder. So most of patients like complain that they're pain in front of it. So rotator cuff injury, a ton of the rotator cuff can be occurred trauma to the shoulder, or it can occur through the like wear and tear. It's for like on the tendon, mostly the proximal tendon found under the acromion. So rotator cuff injury commonly associated with motion, repeated overhead motion, and pulling. So forceful pulling motion can be make the rotator cuff injury. So we can classify by size is for like partial thickness and full thickness. So partial thickness often appear like as a frying of the intact tendon. And full thickness tear is drawn and drawn. But this tear can be a small button or large buttonhole, or involve the like majority of tendon, while whereas still remain the substance intact to the humerus head, thus maintains function. Mm. So we can classify by trauma. So we can divide by acute and subacute and chronic. Most of my patients, they come to clinic about the like chronic case. Like most of Korean patients, I don't know why, but that they have a pain, they just take pain medication, or they just icing something like that. They put in some cooling gel, something like that. After they're just using and they become chronic, and they come to the clinic. So most of my patients I apply like chronic stage of the treatment. So I cannot show it the right now. So I take picture and the video. So acute case. Um, if a patient injury in the acute stage, we should apply 10 to 20% intensity CT and RT. It should be a thermic treatment without heat. In the case of swelling with redness, you need to apply only 10% intensity and the 25 hertz like high tense. 25 hertz high tense can be help with saturation nociceptor, so pain can be decreased. So I using 10 to 20% CT-RT with like 10%, 10 to 20% RT with like 25 hertz like high tense for the control of the pain. I apply the high EMS for drainage program on the lymph around the injury site, not in that site. You should not put in the apply this high EMS drain stage in the injury site. You should try to find some lymph node around the injury site. So it help reducing the swelling. So first 48 hours after getting injury is critical period to control acute condition. So do not forget the athermic care. So first picture is 20 this is for the like 20 the 20% RT and 25 hertz of high tense on the rotator cuff. Second picture is high EMS drained on the pectoralis. Okay, if it is subacute case, after acute stage, I using the like 30 to 40% intensity on the subacute stage. There will be like still some swelling, pain, pain at the end of our ROM, and loss of function on the subacute stage. The healing process of the injury site is really required. So WINBACK is good for the healing process and the recovery. So I'll really like it. So using WINBACK treat the shoulder problem. I use like 2 or 5 hertz of high tense for the stimulating secretion of the endocrine hormone, such as like endorphin. So in the acute case, I using 25 hertz for the like saturated nociceptor. I using like two or 5 hertz high tense in the subacute for the like secretion endorphin or like endocrine hormone. So I apply the radial high EMS on the marge area to release tension of the releasing tension and pumping up the circulation lymph and blood vessel on the injured site. So EMS, I using EMS, radial EMS, but only marginal area, not in the injured site and at this stage. So first picture is for the like RET 30%, and the high tense like 2 to 5 hertz on the rotator cuff. And second one is like high RET. You can see the high RET, see, and with a high EMS radial on the marginal area. In this, okay. So this is video. Okay. Key word of the chronic stage is restoration. The chronic stage is since the point of passing is 3 weeks after onset. In chronic stage, we need to restore the function of the joint and muscle and reduce the scar tissue. So moreover, rehabilitation, strengthening are also required. So I'm using the 40 to 60% intensities I apply it. In the case of breaking the scar tissue, I should use more than 60% of intensity for the short period of time. If I using like more than 60%, I ask patient if it's too hot, let me know. And I stay like 2 or 3 seconds and then move to the other spot. 2 to 3 seconds, I move to the other spot. So you should talk to your patient is it too hot or not. So I using the RET with the high tense. Because of RET is energy like 500 kilohertz, 500 kilohertz, right? Previously, like back 3 SE, we have RT plus, but in back 4 and back 3 TX, we don't have RT plus. So if you using the RT with the high tense, its energy comes to like 300 kilohertz. It going more deeper area than the only RT. So I using like RT for the 500 kilohertz and RT with the high tense at 300 kilohertz. I apply the high EMS directly on the spot because this is chronic stage. So at first I apply the radial high EMS for the more broad area. Then I apply the focal high EMS for the more specific and the more deeper area. So look at this video and okay. So this video like about like 50% and like high tense 2 hertz and is and the high EMS radial. So I start with the pectoral first and the bicep. Bicep is really a good part for the little tension of the front shoulder. So I apply the EMS and then I apply from the deltoid, rotator cuff and deltoid. Okay. After that, I apply supraspinatus. Supraspinatus really a good really important muscle for the like raise up your arm, as you know. Okay. After that, I using subscapular teres minor. You can see the like twitching of the muscle, and that the arm is moving. Okay. So pain control. As I mentioned, I use there's two type. One is like 25 hertz is for the saturation nociceptor. two or five hertz for the like stimulation secretion of the endocrine substitute substance. In the you guys don't know don't have experience, but like there's a new programs Care Plus. There will be high EMS recovery plus. This is very good for after rehabilitation. I do the like do some rehabilitation or like fitness, do the WINBACK. After they finish it, I do recovery. Then it's very helpful. Okay. So I using like chiropractic doctor. So I'm physical therapist and I'm chiropractic doctor. So I really like manipulation. Uh, Previously without WINBACK, when I do the manipulation, I need a lots of force or like sometimes patient feel the soreness after like manipulation. But after using WINBACK, I can apply less force, and the patient is really comfortable about the manipulation. Also, there the decrease the soreness after the manipulation. So WINBACK is make easier and prevent the sore make easier for me. Okay, so this is for the like sometimes I use the fixed pad and the advanced pad if I using if I do the like chiropractic manipulation. But nowadays I using like probe with manipulation. So I can see this video. So this is SSC joint, so sternoclavicular joint. So I apply probe on the proximal, hold on, I proximal SSC joint, and I try to move the clavicle. This one is I apply the probe on the front anterior GH joint or AC joint, and I try to move GH joint. So this is gliding. This is for the elbow. As I mentioned, like bicep is very close to the like shoulder problem. So bicep started from the like around the elbow joint. So elbow function is really critical for the like shoulder problem. So I applied. Sorry, sorry. So okay. I think you guys already saw my manipulation during the key mass about the shoulder. So I using apply probe on the in front of elbow and try to stretch out and mobilize the elbow joint. This is for the scapular. So as I mentioned, the scapular position and the scap movement is very important. As I mentioned, like scapular posture is very important for the rest at the rest, and scapular movement is very close to connection with like uh abduction of the shoulder. So as I mentioned, like if I have a 180 degrees abduction, 120 just came from the GH joint and 60 from the scapular upward rotation. So scapular thoracic joint is should be movable. So I apply probe the RET energy around this joint and try to move my scapular. So this is scapular motion, mobilization with the WINBACK. Okay, this is I apply the superior part of the scapular. Superior part is related with like what the name? So I apply this probe in the superior GH joint and I give the gliding at the GH joint, give the pressure and gliding, give the pressure and gliding of the GH joint. So it can be less pressure on the GH joint. It's really helpful. Okay. So there's some tension of the teres minor and subscapularis. I apply this area of a probe and try to stretch out this inferior GH joint with this motion. So rehabilitation, if I need some rehabilitation with WINBACK, it's much better. So I using sometimes I use watch, or sometimes I using like adhesive patch or fixed patch. This time there's two adhesive patch, and this is return plate. So this is RET with uh, high EMS fit plus rear plus 50%, RET and 50%. So I using a GH joint. You can see the twitching in the muscle. See, if you're using Care Plus, you can experience some twitching in this pad, also in the return plate. So like, so patient can exercise their rotator cuff, especially prospectus, with uh, muscle happiness by the WINBACK. After patient doing this, like he said, like much less painful, much less pain, and very soft to move to their GH joint. You can see the like pectoralis is moved because I apply one patch in pectoralis, the other patch around the like prospectus. So, okay. So if you pain down, thumb down, it can be more like prospectus. Oh, they hold it, this position, hold it, hold it, because if you hold it like they pay some exercise from the prospectus. So look at that there, his arms movement. So you should give some cueing to patient how to move and how to feel of this rehabilitation. After that, I give you some like a quick adjustment about the GH joint for the leisure tension. So after I have a machine with a key implant. It's a EMG machine. So I check EMG, supraspinatus before before the care WINBACK exercise, after the WINBACK exercise. After you just see, as you see, like there the graph is move around like 4 to 8. But after exercise, you go to like 8 to 12. So much better EMG activity. Just only like 3 to 5 minute exercise. And patient said that like pain scale was like was about 6, and is changed to like bus was bus changed to 6 to 3, and his ROM is much better. Okay. Okay, so this is today. So thank you for attention. If you have any question, you can send me my email. Also, we have an official Instagram, WINBACK Asia Academy is WINBACK Asia Academy. Please check our Instagram for the like news and announcement. As I mentioned, next WINBACK Asia webinar at 14th of June by Shinji. It will be about hamstring injury injury, hamstring injury. So mine was like rotator cuff, and Shinji was doing the hamstring, and the other one do the like spine and their knee and hip, something like that. So we have different subject and different um different okay, so different trainers. So WINBACK Asia Academy is just a start, but we can make it bigger and better and remarkable together. So we will see every month the webinar by webinar, and I hope this year we can have some offline uh, seminar, something like that. Okay. Um, okay. So that is my okay.
Dr.
They
Yu, if you may I speak a bit?
yes.
Okay, guys, if nothing's going on, it's going to be every Wednesday or first week of every month
Mhm.
at 9 p.m., right?
Yes, but
Okay.
I will
Mm.
post the like exact schedule and through the Instagram next week.
Okay, thank you. And also, I'm going to record this video, and after I convert it, I'm going to spread it all over. So,
Okay.
I'm gonna share you with the download link, so you guys
Okay.
can check it every time when we do the webinar.
Oh, that sounds good.
Okay. Okay. All right. Thank you, everyone.
So, do you have any question? I know it's first time, so but it's not going too well, but we'll do better. And I hope Shinji make much better presentation than me. See?
Yeah, I'm
Okay.
ready. I'm ready now. And I'm studying English now.
I see you already ready.
Yeah, but so only after a month.
Okay. Actually, next month I will go to Paris. So there's some international the masters meeting, and it came from the Europe and the US some masters. So we will some conference and we will do study together. And I will guys, I'm recording, and I will share the information to you guys later. Okay?
By the way, so actually, so I may go to Las Vegas.
Next month?
Yes.
Oh, for what?
So where will you go in USA?
Me?
Yeah,
Oh no, I'm in Paris. I'm in Europe,
Paris,
France.
France.
Mm.
Okay.
But there's some conference meeting to
Mhm.
the master, so I'll be there, and they're they're shared their idea about how to using the WinBack. So I will bring the my G the GoCam, and then I recording. I do. You guys can see it later. So
Okay.
why you going to the Vegas next month?
So I have my patient and athlete
Ah,
and
ah,
client.
ah. That sounds good.
Yes.
As I mentioned, like their WinBack Olympic hotline right now. So if you're any patient is national athletic who is participate in the Paris Olympic, let us know, and we can connect it with the like WinBack hotline. Okay.
Okay.
Okay. So also it's good to have in Instagram. It's good to have like story, but can you guys make some reels and videos can so you can live with the WINBACK Asia Academy. Uh, so make some video and make some picture and share the co-work or co-relative or something like that. So settings for the WINBACK Asia, okay?
Okay.
Okay, please. Okay, reels and video for the WINBACK Asia Academy Instagram. So lots of people can look at it and they have some idea what we're doing. So I doing some technique, but I hope you guys turn to do the same thing. Okay, please. Okay. I know. So Shinji, you have made lots of video and the story. So his story is going disappear like after 24 hours. So some video make some if some video is really good, like try to leave in the
Thank you.
our Instagram. Okay. Okay. What of Jeffrey? Do you have any good video or something like that in the with your patient? I can hear you. Hold on.
Yeah, I think I met some, but again, those are like just stories. I think Phoenix made some videos too.
Mhm.
I'm not sure if you've seen it, but
Mhm.
yeah, I'll try my best.
Try
Okay.
try to make I forgot the name word, the correlative or collaboration, something like that. You can setting
Okay.
so from
Okay.
that.
I'll check that out.
Okay.
Are you guys coming to Taiwan next month? No,
Taiwan?
I think so, right? No,
Taiwan for
I
what?
don't know. They
You guys,
told me you guys are coming.
I
No,
don't know. I didn't know it.
really? Okay.
Maybe so Japanese go to Taiwan June.
Right,
Ah,
right. Yeah,
Maybe.
I thought
sounds good.
so. Yeah.
Japanese have a like big, I think a beauty some
Yes.
event next week, right?
Well,
Yes.
yeah, maybe. Yeah.
Mm. So I think first Frederick come to will go to Japan this weekend.
May.
And yeah.
Or next weeks.
Beauty World
So
Beauty
yes.
World Tokyo, right?
Oh, coming.
Yes. He will be there. And then he has lots of idea. Okay. How about the Theo? Do you have any new thing happen in Philippines?
Well, we're currently, I think last week we edited some videos as well.
Mm-hmm.
So yeah,
Sounds good.
we yeah, I'm just waiting for the upload. So some of our creatives team
Mm-hmm.
are doing the editing thing, and we're just waiting for the uploads.
Okay.
Wow, luxuries. You guys have like promoting team? Cool.
Yeah,
Wow.
Wow.
handle our social.
Jealous, jealous. Damn.
You should talk to the Eric Yang. Good.
Great.
I know the Korean guys are really shy, but Dongwon and Jason, you guys make some video or the picture and put it in the Instagram. You should okay? How about the CK? I saw your some video and in the Instagram. So please help us. Okay. At first I planned to 1 hour. It's to finish too soon. I'm sorry. I didn't manage it the time. But anyway, I'm really happy to you guys to share my idea. And then I know you guys have different idea about how to try to uh treat the rotator cuff. So if you have some idea, make some video or picture, put in the Instagram, and then we will so this is the official one. So we'll share the idea, and then other people can see what we're doing. Okay. So we will see you next month, like 14th of June. Okay. So have a good night.